Good morning. As the third wave of this pandemic began to grip Canada with rising cases, hospitalizations, and new lockdowns, Mr. Trudeau said that he had no regrets about his handling of the pandemic. No regrets for the closure of the world-renowned pandemic early warning system, closing it down months before it was needed most, or the failure to close the border fast enough to prevent cases in the first wave. No regrets about sending away precious PPE supplies or turning to the Chinese government for a vaccine for Canadians. No regrets for failing to deliver a national system of rapid testing and tracing as he promised in his earliest doorstep press conferences last spring, or for his vaccine portfolio that only delivers sufficient vaccines when more prepared countries are finished vaccinating their entire populations. It is easy to have no regrets when others are left to clean up the mess. That is the hallmark of this Prime Minister. After all, he told the Ethics Commissioner in his first ethics investigation that he views his role as Prime Minister as ceremonial in nature. Canadians do not need a disengaged and ceremonial Prime Minister during a crisis. We need a leader. Justin Trudeau n'a aucun regret pour les millions de Canadiens qui sont affectés par la troisième vague. Aucun regret pour un approvisionnement des vaccins insuffisant et une approche toujours lente. Il n'y a aucun regret pour les erreurs de jugement et éthique, comme avec l'accord pour les vaccins avec une entreprise chinoise ou le scandale We Charity. Quelle arrogance! Pendant que M. Trudeau se félicitait, l'espoir des Canadiens diminue à cause de la progression du virus et les variants dangereux. For a year, we have been calling for greater border measures to protect against COVID-19. For a year, we have been calling for a national system of rapid testing and screening. But even today, people are still not getting tested at the land border. Everyone should be tested at our border. No exceptions. How has this Prime Minister allowed this to go on for so long? How long are Canadians going to have to suffer through the incompetent leadership that announces things and fails to deliver? But here we are, in the third wave of a pandemic, waiting for Prime Minister Trudeau to deliver on commitments that he made during the first wave of the pandemic. I can tell you from my experience before politics, such ineffective leadership would not be tolerated in the private sector, in the military, or in the charitable sector. These organizations embrace continuous improvement, but with Justin Trudeau, Canadians have to suffer through continuous disappointment. The Trudeau government has categorically failed to keep COVID variants out of Canada, failed to secure our border for over a year, and failed to secure vaccines in January and February when they were needed the most. This is Justin Trudeau's third wave, and others are having to fight it on the front lines. Justin Trudeau n'a pas empêché les variants d'entrer au Canada. Avec les libéraux, nos frontières sont hors de contrôle. Après une année, Justin Trudeau n'a toujours pas réussi à protéger le pays. As we watch other countries like the United States and the United Kingdom emerge from the pandemic, Canada sinks deeper into the crisis that is the Prime Minister's making. This week, Canada's Conservatives will push for smarter and swifter action by the Trudeau government on the border, on rapid tests, and on emergency preparedness. Canadians deserve better than a government that leads in flashy announcements, but lags in delivering what they promise. Thank you. Merci beaucoup.
We'll now start the question period. Nous allons maintenant commencer la période de questions. Opératrice, avons-nous une première question au téléphone?
Thank you. Merci. Please press star one at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. Thank you for your patience. Merci de patienter. Our first question is from Raymond Filion de TVA. Please go ahead. La parole est à vous.
Merci. Merci. Bonjour, M. O'Toole. Est-ce que le Parti conservateur compte appuyer le projet de loi du gouvernement pour mettre un terme à la grève au port de Montréal?
Merci pour la question, Raymond. Nous sommes ici à cause d'inaction du gouvernement Trudeau. Pour plusieurs mois, pas d'action sur le port de Montréal. C'est très important pour notre économie et pour les exportateurs canadiens. Et c'est pourquoi on va examiner le projet de loi et trouver une façon d'aider la situation.
Advenant que vous l'appuyez, est-ce que ça ne risque pas de compromettre les efforts que vous avez faits récemment pour tenter de courtiser le mouvement syndical?
C'est pourquoi on va examiner le loi et parler avec tous les partis parce que c'est important de trouver une solution avec une approche de collaboration. C'est pourquoi on a demandé action il y a un mois sur la situation avec le port. Et on va voir l'approche du gouvernement Trudeau aujourd'hui.
Merci, opératrice. Prochaine question.
Thank you. Merci. Notre prochaine question est de Hélène Buzu de l'Écoop de l'information. Please go ahead, la parole est à vous.
Oui, bonjour, M. O'Toole. Écoutez, je vous ai posé la question la semaine dernière, mais comme je n'ai pas vraiment eu de réponse, je reviens à la charge. Je voulais vous entendre concernant votre députée Tamara Jensen, qui, lors du débat sur les thérapies de conversion, a traité son adversaire libéral de unclean et a parlé de lesbian activities pouvant être traitées par des thérapies de conversion. J'aimerais savoir, je comprends que vous êtes contre les thérapies, mais vous pensez quoi qu'une de vos députées dans votre caucus dise une telle chose?
Merci, Hélène. Comme vous le savez, Mme Jensen a présenté ses excuses et elle a parlé directement avec M. Oliphant sur les débats dans la Chambre de communes. On doit avoir une approche de respect dans les débats sur tous les enjeux et ça serait mon approche comme chef. On doit cibler sur le bien-être des Canadiens avec un débat respectueux.
Êtes-vous à l'aise, toutefois, à avoir une dame qui pense une telle chose, qui pense qu'il y a qu'il y a du fondement à des thérapies de conversion dans votre caucus? Est-ce qu'elle a une place chez vous?
Comme vous le savez, je vais voter pour la loi par le gouvernement en ce qui concerne la thérapie de conversion. Et comme j'ai dit aujourd'hui, je suis ici aujourd'hui de parler sur la situation avec la troisième vague et les variants et les risques pour les Canadiens et Canadiennes.
Thank you, merci.
Thank you. Merci. Once again, please press star one at this time if you have a question. De nouveau, n'hésitez pas à appuyer sur étoile 1 pour toutes les questions. Notre prochaine question est de Louis Blouin de Radio-Canada. Please go ahead. La parole est à vous.
Bonjour, M. O'Toole. J'aimerais revenir sur la question du port de Montréal. À vos yeux, est-ce que vous pensez qu'à ce point-ci, il y a une solution négociée qui est possible? Et jusqu'à quel point pensez-vous c'est la dernière option qui reste pour cette loi spéciale?
Merci, Louis. C'est une question importante. Est-ce que c'est possible d'avoir un médiateur, de trouver une solution entre les deux parties avant un projet de loi par le gouvernement? On doit examiner ça parce que en pleine d'une pandémie, le commerce international, les emplois, l'économie sont très importants et on doit trouver une solution. C'est pourquoi on a posé des questions sur la situation à Montréal il y a un mois, mais malheureusement, un mois d'inaction par M. Trudeau.
Quelles sont les conditions qui doivent être réunies pour que vous votiez pour une loi spéciale?
On va parler avec les syndicats et les entreprises, les exportateurs, parce que c'est important d'avoir une solution, bien sûr, parce qu'il y a un risque grave pour notre économie avec une grève pour beaucoup de jours. Donc, on doit trouver une solution et on va examiner le projet de loi par le gouvernement peut-être aujourd'hui, mais en même temps parler avec les autres partis sur leurs priorités.
Thank you. Nous allons passer dans la salle. Avez-vous une première question à la salle?
Mr. O'Toole, Leader Canadian Press. I wanted to ask you about India. Early in the pandemic, you were critical, and you repeated that criticism today, of Canada sending PPE and other supplies overseas. The government has offered to send a variety of different supplies, including oxygen, to India. Do you support such moves? And if so, are there certain things that should be sent and other things that shouldn't be sent?
Thank you, Lee. Yes, I do support helping our friends in India with ventilators, with equipment, if we can. Clearly, the absence of oxygen supplies for the country being ravaged by the variant there is something we should do. At the beginning of the crisis, when we didn't have sufficient PPE and other critical materials, we shouldn't have been sending them around when we didn't have sufficient supply at home. But we've been able to build up some of that. So let's help our friends in India, but let's also have an approach of stopping international flights until we can get a handle on keeping the variants out of Canada. The provinces are demanding more of Mr. Trudeau. Last week we had another half measure, and we see the border being circumvented at the land border. So we need a serious approach to secure the border to keep these variants out.
And I wanted to ask about climate change. Why isn't your party committed to raising Canada's emission reduction targets beyond the current 30% when the 2015 Paris Agreement requires us to do so?
I've said clearly from the time I became leader, Lee, we're going to meet our Paris commitments, meet our international commitments with a plan that is serious and that focuses on job creation and investment. That's what we need after the pandemic. Mr. Trudeau literally makes things up by the day. He changed his own targets twice in 7 days with zero plan to do that other than to raise dramatically his carbon tax. Canadians want a smart, effective, and ethical government. They're not going to get that from Mr. Trudeau. A year ago, he promised rapid testing and tracing for Canada on one of his doorstep conversations. I'm demanding it here today because he never delivers, whether it's climate change, whether it's the pandemic, whether it's boil water advisories. Canadians are getting tired of the constant failures of Mr. Trudeau.
Hi, Mr. O'Toole. Good to see you. David Thurton from CBC News.
Hi, David.
Can you tell us how you and your caucus intend to vote on the budget?
Canadians are disappointed by the budget, and we're certainly very disappointed by the budget. Lots of debt on the shoulders of our children and grandchildren. Definitely a Liberal plan to raise taxes, and no real strategic approach to job creation. A number of little Band-Aid solutions. So we're in the process of also proposing some of our amendments, some of our own policies, but we will not be supporting a budget that really puts at risk our future. With the risk of interest rates in the next few years, Mr. Trudeau is putting our future prosperity at great risk.
And just going back to the border measures that you're speaking about today, can you elaborate a bit more on what are some of the more serious, swifter measures that you would like to see the government take?
The government needs to secure the border by stopping flights from all hotspot countries and, in fact, perhaps all international travel temporarily till we can rectify and secure our border. In addition to that, David, we need rapid testing and a test applied to everyone entering this country, whether in an airport situation or whether at the land border. We see half measures by the Trudeau government, and we see people circumventing the border at land crossings. Everyone should have a rapid test, and we should have a process from there to ensure that there's quarantine provisions for people in their homes. We need to keep these variants out of Canada. We need to secure our border.
Thank you. We have time for one last question. On m'a dit que c'est la dernière question. Opérateur au téléphone, avez-vous une dernière question?
Thank you. Merci. Our next question is from Ian Bailey from the Globe and Mail. Please go ahead. La parole est à vous.
Mr. O'Toole, I'm wondering if you'd support changing the distribution of vaccines from per capita between the provinces and territories to distribution based on need. The Canadian Medical Association's called for this, but the premiers have not, and the Prime Minister has said the premiers would need to agree. Your thoughts on this?
I think we have to tackle the crisis in the most effective way we can, and so public health experts I think are needed to provide certainty on this. And we would certainly look to some of that guidance to see how most effectively outbreaks, particularly of variants, can be suppressed. That can be done by public health measures and obviously by some of the restrictions that we're seeing. But how can we effectively use rapid tests and vaccines? We would be open to seeing a science and data-driven approach by the government. As I've said for a year, Ian, the three key tools in a pandemic are vaccines, rapid tests, and information. We need to have much more public disclosure about public health decisions.
You have a follow-up?
So that's hello?
Go ahead.
Sorry. So that's a science and data-based approach, but is that an agreement to sort of change the distribution of vaccines?
We would certainly have to hear from the government on this. I've been pushing, Ian, because the government's always late and does half measures. The Prime Minister should be bringing together the premiers and all public health officials to have an effective discussion about what to do because he failed on vaccines. The reason why we're seeing this third wave is because we don't have sufficient vaccination levels. Had we had vaccination levels like the United States, United Kingdom, and some other countries, we would not have the risk of spread of these dangerous variants. And that's why we have to make decisions on how to best use this finite supply we have. But I'll tell you, provinces are all frustrated that we're in this situation. We're only at 50% of our vaccination capacity, roughly, because Mr. Trudeau does not have the supply. So let's get the supply and then let's bring the parties together to see how best to use it. Well, thank you, Lee. Yes, my wife and I got the AstraZeneca. I want to thank Dr. Shadbolt and the amazing Rideau Health team that had volunteers in a church parking lot, their families, and it was safe, it's effective. You need to get the vaccine whenever you're able to get it, because that is a tool that will let us turn the corner in COVID. We need to get life back to normal, and vaccines are key. I feel great. I went for my Sunday run yesterday, didn't affect me, and so I think talk to your doctor. As soon as you can get it, I think it's important for us to all do our part.
Thank you. Merci. C'est tout le temps que nous avons. This concludes the press conference. Thank you.
Merci beaucoup.
Thank you. Merci.